Have you ever noticed that something once filled with comfort and closeness, intimacy, now feels uncomfortable, even painful, after menopause? If so, you are far from alone. Many women in their 50s, 60s, and beyond silently experience pain during intimacy. Some believe it's simply part of aging. Others quietly avoid closeness, worried their partners won't understand. But here's the truth: intimacy pain after menopause is not inevitable, and in many cases, it's made worse by avoidable mistakes. By learning what those mistakes are and taking steps to correct them, you can restore both comfort and connection. Hello, I'm Dr. Lisa Perriera. For more than 30 years, I've cared for women through every stage of life, from the childbearing years through menopause and into the decades beyond. I've seen how silence about intimacy issues leaves women isolated, and how knowledge can transform that silence into relief and hope. My mission today is to help you recognize 5 common mistakes that often worsen intimacy pain after menopause. By understanding them, you'll be better equipped to protect your health, preserve your confidence, and nurture your most important relationships. Before we begin, I'd love to invite you to subscribe to this channel. At Elder Care Wellness, we bring you evidence-based health guidance tailored for women over 50. If you've ever wondered whether intimacy pain is just normal, or if you've struggled in silence, share your thoughts in the comments. You might be surprised how many women feel the same way, and your voice could encourage another woman to seek help. So let's dive into the first mistake: ignoring vaginal dryness. After menopause, your body produces much less estrogen, the hormone that keeps vaginal tissue thick, elastic, and naturally lubricated. Without estrogen, the vaginal walls become thinner, more fragile, and dry. This condition is known medically as vaginal atrophy, or genitourinary syndrome of menopause (GSM). According to the Mayo Clinic and the North American Menopause Society, vaginal dryness is one of the most common causes of intimacy pain in postmenopausal women. Yet it is also one of the most overlooked. Many women dismiss it as a nuisance or believe nothing can be done. That silence, unfortunately, allows the problem to worsen. Think of estrogen like the oil in a machine. When the gears are well oiled, they glide smoothly. But when the oil runs dry, the gears grind and scrape, causing friction and damage. That is exactly what happens when estrogen levels fall. Intimacy without lubrication turns into friction instead of comfort. Over time, ignoring dryness doesn't just make intimacy painful. It can lead to small tears, infections, and even a loss of desire because pain has replaced pleasure. I recall one of my patients, Margaret, who avoided intimacy with her husband for nearly 2 years. She told me she felt embarrassed and thought painful intimacy was her new normal. When she finally spoke up, she was shocked to learn that simple solutions existed. Over-the-counter vaginal moisturizers helped restore comfort day to day. Water-based lubricants made intimacy gentler. And with low-dose vaginal estrogen therapy, her tissues regained elasticity within weeks. Margaret later told me, "I wish I hadn't waited so long to ask." Another patient, Ellen, shared a similar story. She noticed dryness and discomfort, but didn't mention it for fear her partner would think she'd lost interest. In reality, her interest hadn't disappeared, only her comfort had. By bringing her partner into the conversation and seeking help, Ellen not only reduced her pain, but also strengthened trust and intimacy in her marriage. Her experience reminds us that ignoring dryness doesn't just affect the body, it can create emotional distance too. The data reinforces this. According to a study published in the Journal of the American Medical Association, JAMA, nearly half of postmenopausal women report vaginal dryness, yet fewer than 1/3 seek treatment. That means millions suffer unnecessarily. The good news is that treatment options are safe and effective. Moisturizers, lubricants, and prescription therapies can all restore comfort. The mistake is not in having dryness, it's in staying silent, convincing yourself nothing can help, or feeling too embarrassed to ask for solutions. Here's the message I want you to remember. Vaginal dryness after menopause is common, but it is not something you must endure. Ignoring it allows intimacy pain to grow worse, while acknowledging it opens the door to relief and renewal. Just as you would never ignore a squeaky wheel in your car because you know it signals friction, you should not ignore dryness in your own body. Address it, treat it, and give yourself permission to rediscover closeness without pain. Once we've addressed the first mistake, ignoring vaginal dryness, the second mistake flows naturally, avoiding conversations about pain. Far too many women feel embarrassed, ashamed, or fearful when it comes to talking about intimacy after menopause. Some stay silent with their partners, worried they'll be judged or misunderstood. Others stay silent with their doctors, afraid they'll be brushed off or told that it's just part of aging. This silence, however, is not protective, it is harmful. When you avoid talking about pain, you allow it to grow both physically and emotionally. The American College of Obstetricians and Gynecologists stresses that open communication is essential for addressing postmenopausal intimacy pain. Pain during intercourse, known medically as dyspareunia, can stem from multiple causes: hormonal changes, thinning tissues, reduced blood flow, or even anxiety linked to the anticipation of pain. By keeping quiet, you deprive yourself of medical guidance that could pinpoint the cause and provide treatment. Silence also deprives your partner of the chance to understand and support you. Imagine you are carrying a heavy suitcase up a long flight of stairs. If you never tell anyone how heavy it is, no one will offer to help. But the moment you speak up, others can step in to lighten the load. Intimacy pain works the same way. When you name it, you give your doctor the chance to recommend solutions, and you give your partner the opportunity to walk beside you instead of leaving you to struggle alone. I remember a patient, Diane, who endured years of painful intimacy without saying a word. She was worried that her husband would feel rejected, so she quietly withdrew. Over time, her marriage grew distant, not because the love was gone, but because the silence built walls between them. When she finally broke her silence in my office, she cried with relief. With treatment and honest conversations at home, she and her husband slowly rebuilt closeness. Diane later told me, "Talking about it was scarier than the pain itself, but it was the only way we found healing." It's important to remember that your physician's role is not to judge you, but to support you. According to the North American Menopause Society, up to 75% of postmenopausal women experience genitourinary changes that affect intimacy. You are not unusual, and you are not alone. By voicing your concerns, you join millions of other women who are breaking the silence and reclaiming control of their health. Doctors today have more tools than ever, from lubricants and estrogen therapies to counseling and pelvic floor therapy. But none of these solutions can reach you if you remain quiet. Partners also play a crucial role. When intimacy pain is hidden, partners may misinterpret withdrawal as lack of love or attraction. But when you open the door to conversation, you allow compassion to enter. Many couples find that simply naming the problem relieves tension, reduces guilt, and builds teamwork. It reframes intimacy from a source of fear into a shared journey of healing. Silence, on the other hand, deepens the divide. So here's the lesson of mistake number 2. Do not suffer in silence. Pain is not something to be ashamed of. It is your body's way of asking for help. Speaking openly, whether with your doctor or your partner, is not weakness. It is courage. By breaking the silence, you give yourself the chance to be heard, to be helped, and to be healed. After menopause, when intimacy begins to hurt many women, make the understandable choice to avoid it altogether. At first, this might feel like a solution. If I stop, the pain stops. But this choice can actually become a third mistake, because completely withdrawing from intimacy often makes the pain worse over time. Here's why. The body is designed to respond to use. Just like muscles grow stronger with exercise, the tissues of the vagina and pelvic floor stay healthier with regular blood flow, stretching, and activity. According to the National Institutes of Health, regular sexual activity, or even non-penetrative intimacy that brings arousal, improves circulation to the vaginal tissues. That circulation helps maintain thickness, elasticity, and lubrication. When intimacy stops altogether, those tissues may become even thinner and drier, which makes pain more severe if and when intimacy resumes. Think of it like a doorway that hasn't been opened in years. The hinges grow rusty, the wood stiffens, and when you finally try to push it open, it resists. In the same way, vaginal tissues that are never engaged gradually lose flexibility. What started as mild discomfort can over months or years of avoidance turn into significant pain. I remember a patient named Linda who stopped all intimacy after menopause because of dryness and burning. She loved her husband deeply, but dreaded the discomfort. Years later, when she finally decided to seek help, the atrophy had progressed so much that her treatment required more time and effort. With patience, therapy, and support, she improved, but she later said, "I wish I hadn't waited so long. I thought avoiding sex would protect me, but it actually made everything worse." Now, this doesn't mean you must push yourself into painful experiences. The solution is not to grit your teeth and endure. Instead, it's about exploring gentle, gradual ways to maintain connection, whether that's with lubricants, moisturizers, low-dose vaginal estrogen, or simply non-penetrative intimacy that allows arousal to stimulate blood flow naturally. Even self-stimulation can play a role in keeping tissues responsive and healthy. The Mayo Clinic emphasizes that intimacy in any form, whether shared or solo, can help maintain vaginal health after menopause. It's also important to remember that intimacy is not just physical. Emotional connection, touch, and closeness are all part of the experience. Many women and couples find that broadening their definition of intimacy reduces pressure and restores confidence. By staying engaged, even in small, non-painful ways, you prevent the cycle of avoidance and worsening pain. So the key lesson of mistake number 3 is this: stopping intimacy completely may feel like protection, but it often creates more harm than healing. By staying gently connected, exploring new approaches, and seeking medical support when needed, you protect not only your physical health, but also the emotional bond that intimacy brings. By now, we've covered 3 common mistakes: ignoring dryness, avoiding conversations, and withdrawing from intimacy altogether. The 4th mistake may surprise you because it comes from a place of good intention, relying only on over-the-counter lubricants without seeking medical help. Many women, when faced with intimacy, head to the drugstore aisle and purchase a lubricant. And while lubricants can certainly help, they are often a temporary fix rather than a long-term solution. According to the Mayo Clinic, lubricants provide short-term comfort, but they do not address the underlying hormonal changes that cause vaginal atrophy after menopause. Moisturizers, similarly, can improve day-to-day dryness, but cannot restore elasticity or thickness to the tissue. Think of it like putting lotion on a cracked sidewalk. It may smooth the surface for a moment, but it doesn't repair the cracks beneath. Vaginal atrophy requires deeper support, something that penetrates and rebuilds the tissue itself. Without medical guidance, you may be treating the surface of the problem without healing its root. I once treated a patient named Joanne who used lubricants faithfully for years. She kept buying new brands, hoping one would finally take the pain away. Some helped a little, but the discomfort always returned. By the time she came to see me, she had resigned herself to believing pain was her permanent reality. With a simple prescription for low-dose vaginal estrogen and some education on daily vaginal moisturizers, Joanne experienced dramatic improvement. She later told me, "I wish I had known this 10 years ago. I thought I was doing all I could." Research supports this. A study in the journal Menopause found that women who used only lubricants reported limited relief compared to those who combined them with medical therapies, such as local estrogen. The difference was not just physical comfort, but also emotional well-being. When intimacy became less painful, women reported improved mood, greater confidence, and stronger relationships. This mistake is understandable. Many women hesitate to seek medical care because they fear judgment, cost, or side effects from hormone therapies. But the truth is, options today are safer and more personalized than ever. Low-dose vaginal estrogen delivers medication directly to the tissues with minimal absorption into the bloodstream. Non-hormonal options like DHEA or laser therapy are also emerging. Without speaking to your doctor, you may miss solutions that could transform your experience. Here's an important reflection: using lubricants alone is not wrong, but stopping there is. Painful intimacy after menopause is a medical issue, not just a personal inconvenience. By talking to your physician, you open the door to treatments that don't just mask symptoms, but actually heal the tissues and restore comfort long-term. So the takeaway from mistake number 4 is this: don't settle for surface solutions when deeper healing is possible. Lubricants and moisturizers are valuable tools, but they should be part of a larger plan guided by medical advice. By seeking help, you honor your body's needs and give yourself the chance to move from coping with pain to truly reclaiming intimacy. The 5th, and perhaps most damaging mistake, is believing that pain after menopause is simply your new normal. Too many women tell themselves, "This is just how life is now," and resign to living with discomfort. This mindset steals joy, erodes confidence, and quietly harms relationships. Most importantly, it is not true. The National Institutes of Health and the North American Menopause Society both emphasize that painful intimacy after menopause is treatable. It is not something you must accept as the cost of aging. When you assume pain is inevitable, you close the door on solutions that could restore comfort and closeness. It's like living with a pebble in your shoe. If you tell yourself you can't remove it, you'll keep walking in pain, even though relief is possible. I remember one patient, Teresa, who delayed seeking help for over a decade. By the time she came to me, she had convinced herself that intimacy was permanently off the table. Her marriage had grown distant, and she carried silent grief. When we started treatment with vaginal estrogen and introduced pelvic floor therapy, she was astonished at the difference. She cried and said, "I can't believe I wasted 10 years thinking nothing could change." Her story is a powerful reminder that pain should never be accepted as destiny. Now let's take a moment to reflect on the 5 mistakes we've covered together. 1. Ignoring vaginal dryness. 2. Avoiding conversations about pain. 3. Stopping intimacy altogether. 4. Relying only on lubricants without medical guidance. 5. Believing pain is your new normal. Each of these mistakes is understandable, and if you've made any of them, you are not alone. Millions of women have walked the same path. But the beauty of awareness is that it allows you to choose differently moving forward. You don't have to accept discomfort as permanent. With medical support, open conversations, and gentle persistence, you can rediscover intimacy that is not defined by pain, but by closeness, joy, and connection. Here's the hopeful truth: your body is resilient even after menopause. With the right care, tissues can regain elasticity, comfort can return, and relationships can flourish again. The journey may require courage and patience, but it is always worth taking. You deserve intimacy without fear, and you deserve to feel whole and confident in your own skin. As we close, I encourage you to reflect which of these 5 mistakes resonated with you the most. Have you ever believed that pain was inevitable or felt too embarrassed to ask for help? Share your thoughts in the comments. Your story could be the encouragement another woman needs to seek care. And if you found this video valuable, consider subscribing to this channel and sharing it with a friend. Together, we can break the silence, spread awareness, and remind women everywhere that menopause may bring changes, but pain does not have to be one of them. Remember, this pain is not your new normal. Relief is possible. Intimacy can be reclaimed. And you, at every stage of life, are worthy of love, comfort, and joy.